Well, we did it. 18 hours of open science, international collaboration, and community fun. We started our symposium at midnight Eastern Time, and it is now 5:30 p.m. Eastern Time. And in these 18 hours, we've accomplished quite a lot. You heard from our State of the Community about all the progress we've made together in the road ahead. You heard in our plenary session about the tremendous advances we've made as a community in large-scale phenotype development and large-scale characterization. Through our network breakouts, we've had an opportunity to interact with each other and think about areas of shared interest and areas where we can develop common solutions. Our collaborator showcase provided an opportunity for our community to share the current research that's going on and share the innovations with each other. We had very thought-provoking panels where we talked about building trust and evidence in its communication, as well as our Women of Odyssey Leadership Forum, which provided us our opportunity to think about not just the science we do, but how we do it as a scientific community. It's now 5:30 p.m. Eastern Time, so I'd like to say to our colleagues in Asia Pacific, good morning. I'd like to say to our colleagues in Europe, a good late evening and thanks for hanging in there with us. To our colleagues on the East Coast of North America, I'd say good evening. And to our friends on the West Coast, I hope that you're having a pleasant afternoon. So I want to thank our sponsors for making it possible to have this tremendous event. I want to thank Bayer, Janssen, IQVIA, Odysseus. I also want to thank our collaborators at the FDA, and specifically for their support through the FDA Scientific Conference Grant Program that made it possible for us to host this event and to have the flexibility to go from an in-person plan to this international conference with thousands of participants virtually around the world. Thank you. I also want to thank our Odyssey 2020 Scientific Committee. If you enjoyed the content of what you saw today, it's these people that you have to thank, because they were the ones that reviewed the content that went into our collaborator showcase, that provided scientific feedback to make that the high quality work that it could be. I specifically want to recognize Maura Beaton and Elise Katzman, who's been doing a lot of the hard work behind the scenes to make this event possible. I want to thank and acknowledge all of the hard work that went into our Odyssey 2020 tutorials. It was pretty amazing that yesterday there were over 500 individuals who were able to learn about the community from the community. And to pull off 5 tutorials in different time zones in Asia and Europe and the United States on different topics, including the OMOP Common Data Model, data quality, tool ecosystem, oncology, phenotype development, that actually takes a village. And you're seeing the village right here on the slide. And I want to thank all of these individuals for donating their time and contributing their expertise to make it possible for others in the community to learn and join the journey with us. I also want to provide a thanks in advance to the team that's put a lot of work into the next 2 days of this symposium. We'll be holding a study-a-thon focused on patient-level prediction and external validation, taking 2 models used in clinical practice and trying to figure out how well do they work across the Odyssey network. The team at Tufts, led by Andrew Williams and including David Kent and Ben Wessler, been hard at work to think about how we can make a clinical impact with the observational research that we can conduct. Also want to thank Jenna Reps and Peter Reinbeck, Evan Minty, Allison Callahan, Claire Blackader, everyone who's been making the preparations for the next 2 days to be a fun and engaging activity for our community. I'm sure there's others I'm forgetting to thank, but I really want everyone to know that I appreciate all the time and effort and energy and passion that you put in this community to make everything that we do a success. But there's one specific thank you that I'd like to provide, and I'm going to need some help to make it happen.
Hello, Craig Saxon, former Washington Redskin quarterback and Super Bowl 26 MVP Mark Rippon here. On behalf of myself and your buddy Patrick Ryan, I want to thank you for all the innovative work you're doing at Odyssey. I also want to congratulate you on 20 years of the Rippon Cup. What an honor that is for me, and appreciate me being the #1 overall pick 20 years ago today. Hope you're doing well, my friend. Join the journey is my message to you. I want to thank you for all you're doing to help our community and our science and all the great work you are doing there. So on behalf of myself and all your friends, I just want to say thank you so much and have a great day. Cheers.
Wait a second, where am I? it looks like I found myself in the middle of the 2020 Odyssey Titan Awards. So it's my distinct honor to congratulate the Odyssey 2020 Titan Award nominees. What makes the Titan Award so special in our community is because they are nominations from the community to the community. Collaborators who are recognizing extraordinary contributions by other collaborators to advance Odyssey's mission. So I think all of these nominees listed on this slide deserve your admiration. But what better way to announce the winners of this esteemed group than our prior Titan Award winners?
Hello, I'm Rima Balinkaya. I'm one of the 3 last year's winners of the Data Standards Titan Awards, and I'm very excited to give this award to this year's winner. Titan Award for Data Standards are to recognize extraordinary contributions by an individual, organization, or team in development or evaluation in community data standards, including OMAP Common Data Model and standardized vocabularies. So, the winner of this year is Claire Blacketier, Johnson Research and Development, Erasmus MC.
So my name is Jenna Reps, and I'm the 2019 Titan Award winner for methodological research. I'm extremely excited to be here for the 2020 Titan Award of Methodological Research. So the Titan Award for Methodological Research is to recognize extraordinary contributions by an individual, organization, or team in development or evaluation in analytical methods for clinical characterization, population-level effect estimation, or patient-level prediction. And the 2020 Titan Award for methodological research goes to Nicolas Thurin, University of Bordeaux. Congratulations. Why, thank you. This is absolutely amazing. Thank you so much. Oh, this was awesome. Thank you.
Hello, my name is Chris Knoll, and it is my privilege to present the 2020 Odyssey Titan Award for Open Source Development. The Titan Award for Open Source Development is to recognize extraordinary contributions to an individual in design, development, testing, and development of open source software to enable observational analysis. And the winner is Anthony Senna. Oh, come on board here. Well, this is quite an honor to receive this award. I would like to thank my family, my wife, my children, Patrick Ryan, and everybody else who's ever given me a shot. Thank you, and I will treasure this always. Good night.
Hello, I'm Danny Petrohambra. I'm one of the holders of the Odyssey Titan Award 2019 for clinical applications, and I'm going to be introducing you to the winner of these awards in this year. I've been given this envelope that shows the secret name of the person who is winning, or the group who is winning this award this year. And this is the award that person is going to be collecting in a minute. Very exciting. Let me open it up. So the Titan Award for clinical application to recognize extraordinary contributions by an individual, organization, or team in generating clinical evidence that improves health by informing better health decisions and better care in the remarkable year of 2020 is Mrs. Jenny Lane from the University of Oxford and the team that produced the data that changed practice by learning or teaching us on the safety of hydroxychloroquine. Jenny, when you're ready, you can come and pick it up.
Thank you so much. I'm extremely excited. This is the first time a person from Birmingham is going to be collecting this award, and I'm extremely excited and super proud to be the Titan Award winner for this year. Thank you so much to the committee, and thank you to everyone who contributed to the study we did together.
I'm Andrew Williams, and I was the 2019 winner of the Community Collaboration Award, and I am very happy to be here to announce that the Titan Award for Community Collaboration to recognize the individual for their collaborative spirit in helping their fellow community members reach their goals is Talita Duarte. Is Talita here? Here I am. Thank you. Thank you, everyone. Thank you.
The Titan Award for Community Leadership to recognize an individual for their leadership in advancing the Odyssey mission 2020 goes to Dani Prieto Alhambra from Oxford University. Thank you, Peter. That's fantastic. Thank you very much. Woo!
Hey, my name is James Wiggins, and I'm excited to be here to announce the 2020 winner for the Titan Award for Community Support. And the Community Support Award is given to recognize an individual, team, or organization for their contributions to ensuring the sustainability of the Odyssey community. And this year's Titan Award for Community Support winner is the Department of Medical Informatics at Erasmus MC. Congratulations.
On December 17th, 2019, I gave a talk at our weekly Odyssey community meeting. The title was Odyssey Community in Action. Where have we been in 2019? Where should we go in 2020? That was December 17th, just days away before the first cases of COVID-19 would be reported in Wuhan, China. And in that talk, I reminded the community about our mission to improve health by empowering a community to collaboratively generate the evidence that promotes better health decisions and better care. I argued that this mission needs to be the cornerstone as we reflect on what we've achieved and as we look ahead to what we could accomplish together. I borrowed a story that Martin Schooney often uses about the Large Hadron Collider and how physicists around the world collaborated together on one important project to make substantial improvements in their field. And I argued that we have the opportunity in Odyssey to become the Large Hadron Collider of observational research. I tried to argue why we need to collaborate even more together as a community. I talked about why we want to learn from as many data sources around the world as possible because it improves our ability to reproduce research. It expands our generalizability of our findings, and it allows us to explore the heterogeneity that may exist in different data sources around the world. I talked about the fact that we've been making good progress on large-scale evidence generation, but interpreting that evidence requires large-scale collaboration. And we talked about how legend as a proof of concept could be expanded to other diseases, but that's only going to happen if we rally even more collaborators together. I used the analogy of the Large Hadron Collider to see exactly what were those physicists doing that was so remarkable. And we looked at the publications that were coming out of CERN. We saw publications of important scientific matters where it was not done by one author or two authors or 5 authors or 10 authors, but papers where 1,000 collaborators were working together to answer a common question. Papers with 2,900 authors working together to solve a common problem. And the question I asked our community back on December 17th, and I asked our community the question, what will be the research that we will do together that will generate 1,000-person co-authored papers? I speculated on a few opportunities that I thought required our community to come together. Opportunities in methods research, including how to examine data heterogeneity across a global health network. Opportunities in open source development, such as validating and developing an international phenotype library. I talked about the exciting opportunity in clinical applications to take the ideas that we've had in legend and think about how we could do comprehensive comparative safety and effectiveness for treatments of any disease. That was December 17th, 2019, days away from our lives changing forever. I proposed some strategic priorities for where Odyssey could go in 2020. I suggested that we should try to finish publications of our completed research before we initiate anything new. I thought that we should execute the world's largest network study, characterizing concept prevalence. Even though it's a simple idea, I thought that there would be tremendous value if we could get enough data partners to participate. I argued that we should collaborate on some specific shared goals, building a phenotype library, improving the CDM documentation, and expanding our open source development, particularly in the area of characterization. I suggested that community education is a cornerstone of Odyssey, and through the Eden Academy, we have the opportunity to expand our reach by generating material that's available in a public setting that would actually reduce the requirement of us having in-person tutorial sessions. And that if we could coordinate the materials within the Eden Academy and the Book of Odyssey, that we had an opportunity not just to enable our existing community, but to grow our community to other researchers who want to join the journey. And I also argued that we should cultivate other network studies which follow Odyssey best practices, because we never would know what type of evidence would be needed. And that's why I'm so proud of what we've accomplished today at the Odyssey 2020 Symposium. You saw the publications of the community that have been released this year. You saw Anna present the concept prevalence result and the discovery that we had that something as simple as counting up the frequency of concepts could actually enable us to have a standardized process for phenotype development. You saw Gautam release the phenotype library and offer a new way for community engagement. You heard from Claire about the fact that the OMOP CDM has an expanded documentation to make it easier for our community to use. And you saw throughout the collaborator showcase all of the open source innovations that have been developed and was featured in large scale characterization, where not only did you see a methodologic breakthrough that Anthony Senna showed you, but 3 clinical applications in answering real questions that matter from Talita, Danny, and Noemi. You saw Henrik present the Eden Academy and how now we have hundreds of researchers around the world using our educational material. But what we could have never anticipated back on December 17th, 2019, was how this community was going to be needed to conduct other network studies which followed Odyssey's best practices. 2020 has taken us on a journey from opportunity to obligation. And while we probably could have predicted that we were going to focus as a community on methods research, open source development, and clinical applications, nobody could have predicted why. And yet when the world needed us most, against a disease that none of us had ever heard of, Odyssey came together. We came together in methods research to examine database heterogeneity around the world, because we recognized to understand this disease, we couldn't look at one institution or one country, but we needed to be able to look at data across the US and Europe and Asia to understand the disease natural history of COVID-19. We came together in open source development, developing new tools to characterize the disease natural history of COVID, to externally validate models that could predict the outcomes of COVID-19, and to conduct estimation studies to understand the safety and effectiveness of these products. We came together in clinical applications, quickly answering the call to design and execute studies to evaluate the safety of various medicines for this disease, and to develop models that can help us understand outcomes for patients. Journeys are different in 2020. Back in March, I was looking forward to going to Oxford for the Odyssey Europe Symposium. It didn't happen. But when one journey ends, another begins. And the journey we started with the Odyssey COVID Study-a-thon probably is the most important journey that I've ever been on in my professional life. And what happened in those 88 hours when we got together set a foundation for how Odyssey can do open collaboration. We proved not just what's possible, but what should be expected of a worldwide community when we all have to come together to address an issue as serious as a pandemic. What we were able to accomplish together is a testament to the tenets of open science and collaboration. We applied the scientific best practices that the Odyssey community has been developed. We used the open source tools that the Odyssey community has built. And we were able to generate high quality evidence to inform patients and providers and regulatory decision makers around the world. We did that because it was an obligation and expectation that researchers need to do something to serve the public health and the patients that we serve. Those 88 hours laid the foundation for what's been the last 8 months of continuous community collaboration. And it demonstrated that the core tenets of what Odyssey is all about in open science collaboration can and should be a path forward to generate reliable evidence. We've proven that the evidence that we are collaboratively generating can improve health by promoting better health decisions and better care. This might be the most important journey that I've ever taken in my life, and I didn't even have to leave my house to take it. So I thought I'd share with you my personal journey this year. Welcome to my house, the place that I've been having a journey this entire year. I thought I'd show you around to understand what experiences I've had collaborating with all of you. Here's my desk. Here's where you've been seeing me sit for all of these months. On my desk, I've got my Odyssey mask. Never leave home without it. I've got a red swingline stapler. George Ripsack gave this to me on the day that he told me he had to move me into a smaller office. That was a couple years ago, back when offices were still a thing. Not sure important anymore. This is my collection of travel adapters. All of the different places I would be normally visiting all of you to join the journey and work on our collaborations together. Instead, I'm sitting right here doing it virtually. Still like having my Odyssey travel adapter from last year though. When I'm sitting at my desk, I have lots of knickknacks to keep me company and to remind me of our community. I like to look at this light. Many of you have seen me working on it and wondering what I'm staring at, and it just lets me have a little bit of imagination and creativity in the day. I've got my notebook from Columbia University that says, "We don't just practice medicine, we change it." And I like to think that that's what we're doing in the Odyssey community every day as well. A couple years ago, I went to South Africa, and I went to the Museum of Medical History, and I was able to pick up these books that represent the textbook of modern medicine back in 1940. And if you look through that book, you realize that medicine is pretty barbaric back there. And I like to have this book right next to me because I realize that the work that we're doing today is shaping the future of medicine. And I hope that we look back 40 years from now at the medicine we're providing today and think about how we can be delivering better care in the future. I keep the stuffed animal of Oscar the Grouch right here. Judy Rakusin gave this to me back in our OMOP days. Our first data quality tool that we developed in the OMOP community was a data characterization tool called Oscar and a data quality tool called Grouch. And when Judy gave this to me, I remembered that I would keep a hold of this as we progress forward. And we look now at all the tremendous work we're doing in the Odyssey community around data quality, and to think that this little guy was just the start of that. A couple symposiums ago, Sean Williams came and he showed us how there's art and beauty in the science that we're doing. He shared with us how the work that we had done with patient profiles, with empirical calibration, with treatment pathways, make beautiful art in their own right. And I keep these in my office every day to remind us about the beauty of art and science and the work that we do. I've got my bookcase with all of my favorite knickknacks. I'll highlight a couple honors for you. A couple years back, I was able to go visit the Saudi Food and Drug Authority and visited my good friend Hisham and discussed how the Saudi Arabian government had an opportunity to work along with their health system to think about how to improve evidence for regulatory decision making. And it's so exciting to me to see now how our colleagues at the SFDA are active partners, to see Fadma's paper published in Pharmacoepidemiology and Drug Safety this year, and to see Thamir taking an active role in all of our Odyssey COVID studies. The Odyssey community was awarded an innovation award by the Reagan-Udall Foundation a couple years ago. I was really honored to accept this award. And what I'm really more excited about is this year how Odyssey has been able to collaborate with the Reagan-Udall Foundation through their Evidence Accelerator program. And under the leadership of Amy Abernathy, we've been able to see groups coming together to collaborate to support this pandemic in ways that we couldn't have imagined before. And it's really an important part of our work as part of the Odyssey community to support our colleagues at regulatory agencies and to figure out how we get evidence in the hands of decision makers as soon as possible. I have this certificate of appreciation from South Korea, as well as some art that we were able to make at our last Korean symposium. Probably my most treasured thing on this bookcase is actually this copy of the Book of Odyssey, written in Korean. Still haven't read it, but I think it's actually a testament of exactly what our community is all about, coming together to create community resources. I also want to highlight that every time I see the work of our colleagues in Korea, I'm reminded about the tremendous dedication that has gone on. This year, a tremendous testament by working together with the Korean government, working with the HERA data to support our COVID work, but also seeing the tireless work and dedication of Chan in supporting our community efforts at all odd hours. Come on, let's keep going. So it's been extremely exciting, and I'm proud to have collaborated with all of you during this challenging year. I want to specifically recognize and highlight our 2020 Titan Award winners. Congratulations, Claire. Congratulations, Nicholas. Congratulations, Jenny. Congratulations, Anthony. Congratulations, Talita. Congratulations, Danny. And congratulations to the entire Erasmus team. Now, my journey this year, thinking about our role as an Odyssey community, has been thinking about our place in trying to generate reliable evidence from real-world data. And we think about the work of building confidence in real-world data and all of the efforts we're putting towards data standards and trying to create open community solutions. We think about establishing best practices in real-world analysis and the work that it takes for us to know that the evidence we're generating is reliable. But ultimately, our mission in the Odyssey community is to generate reliable real-world evidence. Now, George earlier today went through a literature review of everything we did this year, and I think it's a tremendous accomplishment that we all deserve to be proud of. But I can tell you what I'm particularly proud of. This year, as we have been working as a community to publish this work, I've been capturing all of our published papers and hanging them on my walls. I read these papers for their scientific content, for the scientific excellence that we're bringing to the community, but I'm also looking for something else. I'm looking to see how well are we doing as a community in collaborating together. So each and every one of our papers, I'm looking not just for what did we accomplish and how did we do it, but how did we do it? How many people were actually collaborating on our work? I'm also looking to see how many of these scientific publications started at one of these Odyssey symposiums. So as you can see our publications here, we can see we got papers that have had 3, 4, 5, 10, 20 collaborators coming together to establish best practices and data standards. And some of this work has been highlighted in previous Odyssey symposiums, and it's great to see it make it all the way to peer review publication. When we think about establishing best practices for real-world analysis, this is actually an area where we've had tremendous activity in the community. Not only have we seen papers published around the work of Legend and the principles that Martijn and Mark and George and Harlan and others have been espousing, but we're also seeing work in methodologic research and evaluating estimation methods, prediction methods, and characterization methods. What's exciting to me about all of this work is the level of collaboration we're seeing across stakeholders, across organizations. We're seeing papers that are published not by just 1 or 2, but 5, 10, 11, 14, 16, 22 authors coming together for this work. But the area that I'm most proud about is our collective work towards establishing reliable real-world evidence. At the start of the year, we saw the first of our Legend hypertension papers published in Lancet in the JAMA Internal Medicine. We've seen large-scale work covering external validation of atrial fibrillation models. We've seen work published around the world. Much of this work has previously been showcased at other Odyssey symposiums. What we can also see from the evidence, though, is reliable evidence comes not by performing an analysis on one database, but actually using a network to learn from. And so in addition to the number of collaborators that I think is important, we also can see that we've got studies not of one database, but of 9 databases, of 6 databases, of 11 databases, of 14 databases. And it's been really impressive to see all of this work coming together, but I'll specifically highlight this row of papers that are already out from our work just this year on COVID-19. Jenny was highlighted for her work on hydroxychloroquine safety, but in fact, this is a team effort that involves 62 collaborators and 14 databases coming together for us to understand the safety of hydroxychloroquine. Ed Burns' paper, published in Nature Communications, had 69 collaborators thinking about what it meant to study COVID-19 disease natural history in a hospitalized population, covering 7 different databases. Daniel Morales' work looking at ACE inhibitors and the safety in the context of COVID required 33 collaborators coming together to produce this work. Collaboration is about bringing people together, stakeholders together, perspectives together, and bringing data together, not just from one institution or one country, but from around the world. And what I'm particularly proud of what are the overcoming the adversity of this year is how we have collaborated, that even though we are far apart, we're closer together than ever. Follow me. Let me show you what else I'm particularly proud of. This is a map that I've been keeping track of this year. It's helping me understand where is our community and where are our collaborators. It's a scratch-off map. I'm able to scratch off a country every time somebody joins the journey and comes to the Odyssey community. I've been scratching off all of the countries as someone has come to participate in an Odyssey work group, to contribute to the Odyssey forums, or even just to register for our Odyssey Symposium and to go through the process of getting a Microsoft Teams account. What you can see about this map is that it's only this goldish color if it hasn't been scratched out, and it's colorful in every place where we have an active Odyssey collaborator member right now. You can see that almost every state in the United States has been scratched off. We're still looking for an Alaskan collaborator. We've got multiple collaborators in Canada, going from the West Coast with Evan all the way to the East Coast with Jamie Weaver. We've seen a tremendous growth in the Odyssey community in South America, with collaborators joining us from Brazil, Argentina, and Chile. We've seen tremendous activity happening in Europe, thanks in large part to the leadership of Peter and Nige with the Eden effort. Now we have pretty much every single European country represented with active collaboration. And we expect this to be a continued area of tremendous activity, which has been really exciting. I'd also highlight that we're seeing collaborators coming to us from Saudi Arabia, but other areas in the Middle East, including Israel, Egypt, Turkey. We still have more work to go in the African region, where we know that there's still many important public health questions that we can and should be able to support. And I hope that as a community, we figure out how to support these efforts. If I continue even further, we have active collaborations in India, in China, in Thailand, in Singapore, Hong Kong, Taiwan. And it's really exciting to see what's going on with our collaborators in South Korea. We now have the Asia Pacific Symposium coming up in December, where we're going to bring together our collaborators from China and Japan and Korea and Australia all together to be talking about the work within their region. But what's most exciting to me is to see how we can have a regional impact and also a global presence, and how collaborators in the Asia Pacific region are leading as actively as anywhere else in the world. What gets me most excited about what we're seeing in the Odyssey community is that this truly has become a global community where we are working together to solve these global public health questions. So to that, I propose a toast. So I'm going to pour a beer to our Odyssey community. And I want to say cheers to the journey. While we're far apart from each other, we've never been closer. Oh, hey, George. Cheers.
Thanks, Patrick. Cheers. Good to see you at Odyssey 2020.
Zan.
Saúde.
Prost.
Zaha.
Cheers.
L'chaim.
Juha, Odyssey.
Salud to the Odyssey community.
Cheers. Поехали.
Tervisex.
Ajni Sanj, Odyssey Nenam.
Ваше здоровье.
Jejam, Odyssey Genam.
Cheers. Nazdravi.
Budьмо.
Proost mensen, op Odyssey.
Santé.
Cheers.
Cheers.
Cheers, biggest!
오디세이를 위하여 건배.
Cheers.
Salud.
Cheers.
Cheers.
Ваше здоровье.
Cheers, biggest.
Cheers.
На здравие.
Campé Odyssey.
Cheers.
À votre santé.
Cheers.
Cheers.
Atja svastia.
Op uw alle gezondheid. Proost.
Cheers.
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 Salud.
To your health.
Cheers, everyone.
Yansing. Kanpei. Cheers to friends near and far.
Hi.
Cheers.
Proost.
Cheers.
A votre santé.
To the Odyssey community, to all we've accomplished in 2020, and to the many collaborations in years to come. Cheers.